to the sector. And Sterling Bank took a decision a few years back that we are going to spend our resources on sectors that has direct impact on life. And that's why we're calling out what we call the Heart of Sterling, which is basically the spelling for our heart. And coincidentally, the first H there stands for health. And we made our commitment that these 5 sectors, which is health, education, agri, renewable energy, and transport, are sectors where we are going to expend all our resources to ensure that this, changes the life of the people as much as it can. And in health specifically, our mantra is to increase access to health and also increase the quality of health. I know some people in this room have had certain interactions with some of them, and for the new ones as well, this is just to let you know that Sterling Bank is here to support the health sector as much as we can. We have made that commitment that whatever it takes for us to achieve the UHC for Nigeria, the bank is willing to put its expertise, its money, its relationship, its commitment, and its collaboration into it. As we've done this during the COVID era, we're also going to do this across all of the states across the country, as well as the government and the central. And that is what we do, because that is who we are. And we are here to also let you know that at this event, we're supporting the organizers of this event, and also whatever deliberations happens here today, please understand that you have a partner in Sterling Bank that is willing to support the health sector as much as possible. Thank you, and I wish us the best of deliberations here.
Your Excellencies, distinguished ladies and gentlemen, moving forward on the list we have for goodwill messages, it is my pleasure to invite the WHO country representative, Dr. Walter Kazadi Molumbo, for his goodwill message. A round of applause for him, please, as he comes up.
Your Excellency, the Executive Governor of Ekiti State, Coordinating Honorable Minister for Health and Social Welfare, Minister of State, distinguished delegate, please allow me to stand on existing protocol. So I'm very glad to be part of this historic event, the 64th National Council on Health, with the theme Building Resilience and Inclusive Healthcare System for Health in Nigeria. This comes at an opportune time when the new government, with health at the core of its New Hope agenda, is putting strategies and structures together to ensure that health is a human right and the duty of government, a means of poverty reduction, and the critical enabler for economic development. Time has come to consider health not as a consumption good, but as an enabler in its own right for economic development of the country. Let me first congratulate the Honorable Coordinating Minister of Health and Social Welfare, Prof. Muhammad Ali Pate, who on his appointments has hit the ground running in recognition of the enormous work that needs to be done to reform the health sector in Nigeria. I also wish to congratulate the Honorable Commissioners of Health, most of whom are new, on their appointment and the ongoing commitment to the improvement of the health sector in your various states. The NCH, as you know, provides a unique opportunity for the leaders of the Federal Ministry of Health and the State Ministry of Health, with support from partners, to evaluate implementation, co-create new ideas, and take far-reaching decisions on the future of the health sector in Nigeria. Indeed, the sub-theme of this NCH are very appropriate as they focus on critical issues of health workforce, evidence-based research and development, health system governance, access toward UHC coverage, digital transformation, and health innovative financing. It's heartwarming that Nigeria has prioritized primary health care and health financing has accelerators to achieve universal health coverage and the SDGs. We all know they are all lagging behind because of a negative impact of COVID-19 pandemic. What will be useful is a radical shift from mere concept to clear actions with measurable results in line with the recommitment of member states at the international conference in Alma-Ata, where it was celebrating the 45th anniversary of Alma-Ata Declaration and the 5th anniversary of Astana Declaration. Executive Governor, Honorable Coordinating Minister, distinguished delegate, ladies and gentlemen, let me use this opportunity to re-establish the commitment of WHO as the Secretariat to Member States toward providing technical support alongside with other development partners as a member state organization toward healthcare needs of the country. Our emerging fourth country cooperation strategy has taken inspiration and direction from the health priorities of the renewed Hope Agenda and the four strategic pillars of the Health Sector Renewal Investment Program of the Federal Ministry of Health. I'm glad that our network of field offices is already responding to the ever-changing contextual needs of the 36 states plus FCT. Permit me, as part of my concluding remark, to suggest what can be done differently. As the NCH is the highest health decision-making body in Nigeria, it will be useful to explore innovative approaches toward the engagement of the Federal Ministry of Health and the state in between councils toward improved performance and tracking implementation of council resolution. Finally, the business of health is the business of all. I therefore congratulate all sectors of the government, development partners, key stakeholders, including the private sector, the civil society organizations, the media, as well as community members on the success of this very important event. In the spirit of this effective partnership, it's my hope that rising from the historic event, together, we all will be more empowered and inspired toward promoting health, providing health, and protecting health of Nigerians without leaving anyone behind. Thank you again for the opportunity.
Your Excellencies, distinguished ladies and gentlemen, with this, we draw the curtain on the goodwill session. However, before I step down, as a citizen of Ekiti State by extension, having served as a medical youth corps here many years ago, I'll lend my voice to say to everybody, Ekabo, Ekubadu. But then again, as a citizen of Nigeria, I will also say to you all, Barka Dezua. Umunem Nano. Thank you very much for listening.
Thank you very much, Adaeze, at least for welcoming us in those languages. Your Excellencies, distinguished ministers, distinguished ladies and gentlemen, Ekiti is noted for taking the lead in so many aspects. This morning, I will be inviting the world champion to give us a cultural performance all the way from India. They were crowned the world champion, having led others that came to represent the world. So I have this morning bringing up the Ekiti State Performing Arts Company to treat us to some cultural display in about 3 minutes. Over to you.
Mo dúpẹ́ lọ́lọ́run Olódùmarè o, Ekiti digi alóye náà kárí ayé o lọ́rùn ọba ṣeun. Àti kóra jọpọ̀ lẹ́kìtì náà wà lólóríire láyé ráṣẹ dá. Ekiti kọ́ lọ sókè alulẹ̀ láéláé. Àlàáfíà ṣe kókó, ìlera lógún ọ̀rọ̀ o. Àlàáfíà ṣe kókó, ìlera lógún ọ̀rọ̀. Ọ̀nì kò rójú kọ́ ọ̀ráyè líròdé o. Àlàáfíà ṣe kókó,
ìlera lógún ọ̀rọ̀.
àlàáfíà ṣe kókó.
ìlera lógún ọ̀rọ̀.
Ọ̀nì kò rójú kọ́ ọ̀ráyè líròdé o. Ẹwẹ́ wẹ̀ nílẹ̀ kẹwẹ́ dọ́kọ́. Èkìtì ní gómìnà yìyẹ. Òun lójú rọ́ṣẹ̀ ti tù kéèké tán rárá ìdánwò. Amájọ sọ̀rọ̀ ọba lára mú lásìkò gómìnà Bíọ́dún Àbáyọ̀mí Oyèbánjí. Ọmọ alágogo àjìlù gbọ̀ngbọ̀n níjọ́sí o ìlẹ́mẹ̀lẹ́yìn kùlẹ̀ Adéwúre èsù kọ́ gbìbọ̀rọ̀dé rẹ̀. Mo kéde dúkẹ́ lẹ́yìn ìgbìmọ̀ àjọfẹ́ o. Bàbá ìrẹ bàbá mi Adéoyè Àríbásóyè èsù kọ́ gbìbọ̀rọ̀dé rẹ̀ bàbá. Mo kí ẹsẹ̀ ìjì lẹ́kìtì. Aláàjà dókítà mi Abíbáàtù mi Adúbíàró. Àyàwó aládùn máa gbádùn ní tẹ̀rẹ̀pẹ̀rẹ̀. Ìbámidélé kí n gbọ́ bí ọ̀rọ̀ kíkẹ́jì ni ọ̀sẹ̀dẹ̀rẹ̀ o kọ́mọlọ́fẹ́ kọmíṣánná ọ̀fẹ́ ti lẹ́kìtì dìde dúró kó ọjọ́ rí ọ. Bàbá ìrẹ́ bàbá mi akọ́mọlọ́fẹ́. Iyó mi ìlera ṣe kókó ìlera lógún ọ̀rọ̀ o. Ọ̀nì kò rójú kọ́ ọ̀ráyè líròdé o. Àlàáfíà ṣe kókó.
ìlera lógún ọ̀rọ̀.
Professor Mohammed Ali Potin, Coordinator Minister for Health, Social Welfare Àmì Ọlọ́lá, Bámikí Dr. Túnjí Aláùsá, Bàbá ìrẹ́ bàbá mi Honourable Minister of State Health and Social Welfare Àgbàre o. Àlàáfíà ṣe kókó.
ìlera lógún ọ̀rọ̀. Ọ̀nì kò rójú ọ̀ráyè líròdé o.
Dájú kájọ ọ̀nà mi Ebenai, Permanent Secretary, Federal Minister of Rights, Abuja létí ìdáyé ẹ̀dára ní Kálálẹ́. Tọ́jú Honourable Dr. Oyèbánjí Fílàní o, Commissioner of Health Ekiti. Bàbá ìrè bàbá mi ọlọ́lá, ìlera lóògùn ọ̀rọ̀, ìmọ̀já tọ́jú ọ̀rọ̀ o.
ìlera lógún ọ̀rọ̀.
Ní kí n jẹ́ àtọ́jú ọ̀rọ̀ rà.
ìlera lógún ọ̀rọ̀.
Kẹ́tì ọmọ Nàìjíríà.
ìlera lógún ọ̀rọ̀.
Commissioner for Health Ekiti.
ìlera lógún ọ̀rọ̀.
Fílàní ká tọ́jú ọ̀rọ̀ rà.
ìlera lógún ọ̀rọ̀.
Àyíká ra kẹ́ ẹ mọ́ tó ní.
ìlera lógún ọ̀rọ̀.
Aṣọ ọ̀sánù kẹ́ ẹ mọ́ lára mọ́.
ìlera lógún ọ̀rọ̀.
Káfọyín ẹnu ra kẹ́ ẹ mọ́ tó ní tó ní.
ìlera lógún ọ̀rọ̀.
Káàjẹ jíjẹ ayẹyẹ sẹ́nu ra.
ìlera lógún ọ̀rọ̀.
Ìmọ̀já tọ́jú ọ̀rọ̀ o.
ìlera lógún ọ̀rọ̀.
Gómìnà Èkìtì ò fọ̀rọ̀ ìlera ṣeré.
ìlera lógún ọ̀rọ̀.
Ìlera ọmọ òjò ọdọ́mọdún márùn-ún.
ìlera lógún ọ̀rọ̀.
Pàtàkì ní ìlera arúgbó.
ìlera lógún ọ̀rọ̀.
Kọmíṣánná tèmi ọlọ́lá.
ìlera lógún ọ̀rọ̀.
Bàmí Fúlàní máa gbọ́dọ̀ ààrẹ ọ̀nìrè.
ìlera lógún ọ̀rọ̀.
Èsù kọ́ gbìbò lòdì rẹ̀ ọmọ ọlọ́lá o.
ìlera lógún ọ̀rọ̀.
Àìmọ̀já tọ́jú ọ̀rẹ́ o.
ìlera lógún ọ̀rọ̀.
Kété Commissioner of Rights.
ìlera lógún
Ní
ọ̀rọ̀.
kété stéètì ní Nàìjíríà.
ìlera lógún ọ̀rọ̀.
Àwọn ìka tọ́jú ọ̀rẹ́ o.
ìlera lógún ọ̀rọ̀.
Ẹdúró o dàbọ̀. Èkìtì Èkìtì lọ́mọ ire Èkìtì Èkìtì
lára ire.
Èkìtì lọ́ní o Èkìtì lọ́mọ ire.
Èkìtì. Èkìtì lára ire.
Gómìnà Èkìtì ọmọ ire Oyèbánjí ọmọ ire.
Èkìtì. Èkìtì lára ire.
Abẹnulé ìgbìmọ̀ aṣòfin Èkìtì ọmọ ire.
Èkìtì. Èkìtì lára ire.
Bàmí Àríbásóyè ọmọ ire lòyíṣẹ́ o.
Èkìtì. Èkìtì lára ire.
Gómìnà Oyèbánjí àsìkò ìtẹ̀rẹ́tù ọlọ́rọ̀ lẹ́kìtì.
Èkìtì. Èkìtì lára ire.
Bàbá ò tiwa ò kọ́ bá ṣe lọ.
Èkìtì. Èkìtì lára ire.
Àti lọ́mọ ire o àti lọ́mọ ire.
Èkìtì. Èkìtì lára ire.
Ọmọ bá ṣe lọ Oyèbánjí bá ṣe lọ.
Ọmọ bá jà lọ.
Báwo kọ́ ṣe ò lọ síwájú.
ọmọ bájà lọ.
ó ṣe ìdàgbàsókè.
ọmọ bájà lọ.
gómìnà bájà lọ.
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 ọmọ bájà lọ.
ìkéréje ìkéréje ìkéréje. Ufete ya ìjàlọ ìkéréje o. Ìjà múlẹ̀ o ìkéréje. Ọlọ́jọ́ ìkájọ́ kárí èyí mi ọ̀ dára mẹ́ o. Orí kàmí jìnnà ògbárùkù lọ́lùkọ́ fi hàn sọ́dọ̀ gidi. Ìkéré mú jẹjẹ o, ìkéré mú jẹjẹ o. Irimẹsẹ lóní o, irimẹsẹ o, irimẹsẹ. Irimẹsẹ lóní o, irimẹsẹ o.
Àrẹ̀mẹ́sẹ̀ o.
Irimẹsẹ o, irimẹsẹ.
Àrẹ̀mẹ́sẹ̀.
Irimẹsẹ lóní o, irimẹsẹ o.
Thank you so much. That was an awesome performance from the Ekiti State Cultural Troupe. Thank you so much. That was really, truly entertaining. Thank you so much. And like they said, Ilera Logwaro, truly, health is wealth. Thank you so much for that entertaining performance. Next on our agenda this morning is the address by the Honorable Minister of State for Health and Social Welfare. Distinguished ladies and gentlemen, please join me with a round of applause as we welcome Dr. Tunji Alausa, our Honorable Minister of State for Health and Social Welfare, as he gives the address. Thank you and welcome, Honorable Minister of Health, sir.
Thank you. Thank you. His Excellency, the Executive Governor of Ekiti State, Governor Abiodun Oyebanji, the Coordinating Minister for Health, Professor Ali Pate, the Permanent Secretary, Federal Ministry of Health, Mrs. Daju Kacholom MNI, Speaker of the House of Assembly, the Speaker of the Ekiti House of Assembly, the Honorable Commissioners from various states that are present here today, agencies, head, directors, and the top medical committee of the Federal Ministry of Health, development partners, distinguished ladies and gentlemen. I'm very delighted to be here at the 64th National Council of Health meeting taking place here in Ekiti State. This year's theme, building a resilient and inclusive healthcare system for a healthy Nigeria, is apt and is so relevant to the current focus of our leadership at the Federal Ministry of Health and Social Welfare. It aligns fully with the marching orders that we have received from the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, to transform the Nigeria healthcare system to deliver meaningful and comprehensive healthcare to every citizen of Nigeria. As part of our transformation of the healthcare delivery system, which we plan will result in some of the followings: efficient healthcare delivery system where unnecessary maternal and infant mortality will be eradicated. Reverse the increasing incidence of sudden death from non-communicable diseases. Combat infectious disease and the associated antimicrobial resistance. Eliminate the scourge of malnutrition that we're witnessing in some of our states of the Federation. The COVID-19 pandemic in Nigeria exposed the innate deficiencies in our healthcare system. The sector response to the challenges imposed by the pandemic highlighted the gross inadequacies of our healthcare system. This would not have occurred if we had planned our healthcare system to be robust and guarantee not only physical, but social and national security to the citizens of our country. I have said in several fora that I have attended lately that we must take a pragmatic approach in the way we respond to our current problems of human resource for health. We have interrogated the production of doctors, nurses, pharmacists, and other allied health workers in the country. The registrars and CEOs of the relevant regulatory bodies have now been mandated to double the enrollment in our institution in the next academic year. While it may be difficult to prevent the migration of individuals for greener pasture, we can respond by increasing the pool of healthcare workers that will graduate from our institutions. Doing this will reverse the negative impact of the JAPA syndrome that we're all witnessing in the country today. State governments are called upon to respond more to this ambitious drive that we have laid out for ourselves by creating sustainable pool of human resource for health, by allocating more funding to their healthcare training institutions, allocating more funding to development of infrastructures, and equipping their hospitals with state-of-the-art medical equipment. As a matter of urgent priority, we must focus on developing our current research ecosystem if we are to unlock the healthcare value chain that can generate tens of thousands of jobs, durable, sustainable jobs to our teeming young population. It is high time we began to use evidence-based approaches to drive our healthcare decision-making process and develop a well-coordinated knowledge transfer platform. We are rejigging our healthcare research ecosystem to position us to attract significant investment into our healthcare sector and make Nigeria the destination and hub in the sub-Saharan Africa for research, which will not only include clinical trials, but vaccine trials and genetic studies. We have recently reconstituted the National Health Research Committee and the National Health Research Ethics Committee. These two committees will be inaugurated in the next coming weeks. The work of the National Health Research Committee will include to support the harmonization of all health-related research from international, national, state, and local institutions with the potential to provide significant economic development to our country. Support the creation of platform that encourages and propels healthcare research startups. Accelerate multidisciplinary research, including clinical trials, that will contribute to innovation in priority healthcare areas in our country. Provide platform where researchers and policymakers can interrelate to provide evidence for decision-making by supporting the development of a national health research repository. This should also help our young Nigerian researchers develop the needed skills in grant writing so that they can take advantage of local and international grant opportunities. With regards to the universal healthcare coverage, we cannot afford to fail our citizens. This will require financing and leadership.
Our current level of out-of-pocket spending, which is over 70%, is unacceptably high. Therefore, there is need for equitable and comprehensive health financing that is affordable with a national geographical spread. The newly appointed Director General for the National Health Insurance Agency and the National Primary Healthcare Development Agency, working with the Federal Ministry of Health, are currently conducting a situational analysis to strengthen the operationalization of our basic healthcare provision fund and the existing National Health Insurance Agency model to repurpose it to serve more Nigerians. We shall continue to advocate for increased domestic funding, but it is important we critically examine and reset where funding is being allocated and expenditures incurred. We encourage all health commissioners to increase efforts towards prioritizing health prevention, promotion, and maintenance, as well as putting policies and measures in place to achieve sustainable development of their respective state health sectors. The numerous challenges we face today can be significantly averted with well-coordinated funding in line with our national priorities and agenda. With regards to digitalization of our healthcare sector, the future is now here with us. Digital health merges digital technologies with health, healthcare, living, and society to enhance the efficiency of healthcare delivery to make medicine more precise and personalized. Beyond optimizing and launching a robust electronic medical record system, which will improve our health data governance at all levels by strengthening the existing data architecture to ensure seamless data collection, dissemination, and usage. Let me seek your support as the coordinating minister and I am all ready to work with states to navigate this perennial issue. We are leaving no stone unturned to support our hospitals and thousands of primary healthcare centers to have a robust electronic medical system that fits into a national health information system. In conclusion, we're looking forward to regular engagement with the state to have a health system that serves every citizen of Nigeria in a meaningful and comprehensive way. I cannot end this remark without a deep sense of appreciation. Once again, to our host, the Executive Governor of Ekiti State, Mr. Biodun Abayomi Oyebanji, for opening up your state to the National Council of Health. I would also like to personally thank you for your hospitality and the love you have showered on us since we've been staying here. I would like to thank our host, Honorable Commissioner, Dr. Oyebanji Filani, for the amiable and hospitable environment that you have provided to all the delegates. Let me also thank everyone who have contributed in one way or the other to the success of this year's National Council of Health. My special thanks go to the NCH Secretariat that is led by our able, capable, amiable Permanent Secretary for Health, Mrs. Dajo Castronom, MNI, and please let's give the Secretariat a round of applause, and Dr. Chris Osa Isoponku for all the hard work that you have all done in the last 4 months. Let's give them a bigger round of applause, please. Thank you, and thank you, everybody. Thank you for listening, and God bless the Federal Republic of Nigeria.
Thank you very much, Honorable Minister. Please let's give him another round of applause. One thing we enjoy in the Federal Ministry of Health is that when you're talking to one of the ministers, you're actually talking to the two of them. And both of them take decisions together. The same way, if you go and gossip to one of the ministers about the other one, be very sure that the other one will hear. And you will actually be talking to the person that you were gossiping about. They are so synergic in the way they do their things. Distinguished ladies and gentlemen, Your Excellencies, Honorable Ministers, distinguished ladies and gentlemen, do forgive me. I'm learning from His Excellency on how to manage this Babariga or the Agbada. And I think, Your Excellency, I would have to come for some lectures. My Honorable Minister had been giving me a few lectures, and maybe I want to get the plus. We've come to the high point of the opening ceremony, or just before we get to the high point. It's time for us to really get to dig deeper into the theme of this event. The Honorable Minister of Health was very, very deliberate in selecting the theme of the event. This is the first time in many years that the minister has to personally sit down and say, this is the theme, these are the sub-themes, and this is why I am picking them. And in the same vein, and do remember, ladies and gentlemen, that I have said that they speak the same language. So when one is talking, it's actually the two of them talking. In the same vein, they selected the right person to speak on the theme. And it is my pleasure at this time, and by the time he has finished speaking, I'll leave you to be the judge of whether or not he was the right person or not. My pleasure, Your Excellency, Honorable Ministers, Permanent Secretary, ladies and gentlemen, to invite to the podium the Country Director for the World Bank Group Nigeria, Dr. Shubham Chaudhry, who will be delivering a keynote address on the theme, Building Resilience and Inclusive Healthcare System for a Healthy Nigeria. Dr. Shubham, as he comes on, let's give him a resounding round of applause.
Your Excellency, Governor Abiodun, Honorable Coordinating Minister, Professor Pate, please allow me to stand on existing protocols. And ladies and gentlemen, good morning. It really was quite a surprise, I should say, but undoubtedly a privilege to have been asked to give these remarks this morning at the 64th meeting of the National Council on Health. Not least because, even though Dr. Chris keeps, saying Dr. Shubham, I'm not actually a doctor. The true doctors are the ones you have in the room, the medical doctors. I'm an economist, So I always hesitate and I ask, please don't call me doctor. So you may wonder, why am I here speaking about healthcare when I'm an economist? I think it is because investing in the health and well-being of every single Nigerian, every single person around the world is so key to almost everything else. Health is, we talk about human capital. Human capital is a key ingredient to economic development. So health does matter for economics, and vice versa, economics matters for the topic of this council, building resilient, inclusive systems. I've kind of narrowed it down to a very simple kind of aim. It partly reflects, what we've adopted as our aim here in trying to support Nigeria. One of the aims is this: how do we help ensure quality basic health care for all Nigerians? So I'm going to give a very short presentation, beginning with just taking stock of where things stand, where Nigeria stands at this point. Much of this you may know, but just to see the numbers there, I think, and the link between health and the economy, health and public finances. That's part of the link that I'd like to draw here. That link will then lead me to say that, the priorities, in very simple terms, it's easy to state, much harder to implement, are to spend more on health. Nigeria definitely needs to spend more on health, but also, and very importantly, to spend better on health. And the way to do both, I think, and this is, I think, already reflected. You've heard about the Honorable Coordinating Minister's vision for how he wants to really kind of reinvigorate and have this big push to improve health outcomes in Nigeria is a compact. And it's a compact then between the federal and the states, and this is why, Your Excellency, the governors are key. You've heard me say this before. The governors are key for almost everything that matters, not just on health, but on the development front. So the federal and the subnational, but also as we're here as international partners, it matters a compact between Nigeria and those of us who are here to try and help you and support you in your journey. So this picture, some of you may have seen this before. I often say that this picture is, the human development outcomes in Nigeria are among the lowest in the world. And when I first saw this picture, which shows the human capital, what the World Bank back in 2018 devised, I believe, Dr. Pate, you may have been there at the time, the Human Capital Index, which is to say, that conceptually, it's a very simple idea. A child born in a country, if things continue to remain in that country the same as they are at the time of birth, how much human capital will that child have when she is ready to enter the workforce, to become a productive citizen? And what does that depend on? It depends on the kinds of things we are talking about today. What kind of health care they get, what kind of health care the mother got when the child was still in the womb. What you see here is that looking across the world, Nigeria is about the 6th lowest in terms of human capital index. And that's certainly controlling for income. Nigeria is pretty much the lowest, but even if you look across countries, and I saw this, and this is one of the reasons I say on a personal note, what brought me to Nigeria. Because I saw the similarities between Nigeria and India, where I'm from, Nigeria and Indonesia, and yet on this one data, or one bit of evidence, Nigeria seemed to be lagging behind. And you see that in all the other health indicators, and I think this is where the sense of urgency that I've heard the Honorable Minister kind of mention so many times, that sense of urgency comes from. How do we make concrete, rapid progress in helping improve these health outcomes? There's also one other thing I just want to point out, that you see the Human Capital Index, that's Nigeria as a whole, but there's remarkable diversity, very pronounced disparities within Nigeria. Just let's focus on child mortality. These numbers might be a bit out of date. I haven't seen the latest data from the latest surveys, but so the light blue is the best performing of Nigeria's 6 regions. So this is under 5 mortality. The dark blue is the worst performing of the 6 regions. What you see there, and the light gray is where upper middle income countries are, and the dark gray is where the average for low income countries. What you see there is the best performing region in Nigeria is basically on par with upper middle income countries. The worst performing region in Nigeria is below the level of low-income countries. So that says that for Nigeria to make progress It really, the country has to come together to support those parts of the country that need the most help. And it really does come down to the states, to the regions, but that's where this link between the federal and the subnational becomes so important. Now, one of the reasons, as an economist, when I think about human development outcomes where the role of government matters, say government needs to spend. So, well, one explanation you may say is, look, government spending in Nigeria, this is federal and subnational combined, is pretty much the lowest in the world. An average rule of thumb is that for a government to do its basic functions, basic services, primary health care, basic education, law and order, rural roads, government should be spending between at least 15 to 20% of the size of the economy, of GDP. In Nigeria, that was 12%. That's an average. It's been much lower. And government spending on health and education is particularly low, both in absolute terms and as a share of GDP. So what you see on the left hand is, let's just focus on health. The estimates, we did this from a detailed public finance review that we did jointly with the NGF, Nigeria Governors Forum, and the Federal Ministry of Finance. Federal government spends about $7 per capita a year, and state governments, $8, $15 roughly. And those may have been dollars calculated at the exchange rate that prevailed at that time. So that would be a lot lower now. And on the right hand, you see it's 0.8% of GDP on health. That seems low, and from a global perspective, it is low. Look at where government spending on health is as a share of GDP. In Nigeria, the light blue, compared to the dark blue, by the way, are all the other countries, your neighbors in Africa. So these are not rich countries. Okay, the rich countries are the light gray that you can barely see up on the right there. Okay, but this is light blue compared to the dark blue. Now, one reason why governments can't spend is because they aren't taking in enough, and sure enough, government revenues are also very low, and in fact, shockingly low, 7% of GDP. And they've been declining. And this again is consolidated, federal and subnational. You will see it went down from 13% in 2011 to 7% in 2021, went down to 6% in 2022, and hopefully it'll be higher in 2023. Now, you might think that government is spending less on health because revenues are low, but there's another thing, that government spending on health is also low in Nigeria as a percentage of overall government expenditures. That is not just a simple kind of matter of financial constraints. That is a policy choice. So it is about governments, state governments, as well as the federal government, choosing where and how to spend the limited fiscal resources that they have. And here again, you see Nigeria, there are other countries that choose to spend less, devote less of the government budget to health, but Nigeria is amongst the lowest. And even there again, you see the contrast between the light blue and the dark blue. Dark blue, other countries in Africa, including your immediate neighbors. So from this, I think one thing is obvious, Nigeria clearly needs to spend more on health. And I said this actually at a National Council on Health panel 2 years ago, that even though you're medical doctors, public health practitioners, and your passion and your commitment is to health outcomes, please pay attention to the fiscal issues, because that is a big part of how far you will be able to go. So just some thoughts on some options that you may want to consider. Raising more revenues, that's a clear imperative, and that's both at the federal and at the subnational. I mean, one option that, I remember there was a memo at the National Council on Health 2 years ago, was to introduce or increase a set of health taxes. Excise taxes on cigarettes, beer, wine, alcohol, sugar-sweetened beverages, I mean, it's almost like a win-win, at least to the levels prevailing in other ECOWAS countries. Nigeria is right now, the excise taxes, to the extent there are any, are lower than every other country in Africa on these items: cigarettes, beer, wine, alcohol, and sugar-sweetened beverages. And we did a lot of work at the request of the Ministry of Finance on this 2 years ago. And the estimates were that just to raise them to the level, I mean, could be gradually, but if raise them to the level that your neighbors in ECOWAS have, would generate 600 billion naira per year in revenues. How much is in the BHCPF this year? So that gives you a sense of the scale. But while those revenues are being raised, I go back to the policy choice, which is that even within the constrained envelope, that fiscal envelope that you have right now, that state governments have, there is scope to increase the budget allocation to health. And every time I say policy choice, I keep looking at His Excellency the Governor. And I know, Your Excellency, that you have already started to make some of those policy choices. And that's a matter of persuading, at the federal level, the Federal Executive Council, the National Assembly, and persuading the governors. And then to make the case that delivering quality basic health care is not just the right thing to do, it can turn out to be the politically smart thing to do. I mean, we've seen this in other countries, if it's done robustly. One caveat, and then I'll explain why I mentioned this, if you look at international partner support for Nigeria, the health sector is the envy of all the other sectors. You talk to your colleagues, the commissioners of education, or they will say, you guys shouldn't complain, you get so much support from the international community, which is true. Support in terms of from international partners in terms of grants, as well as concessional finance from multilaterals like the World Bank, is an order of magnitude higher for health than it is for agric or education or any of the other development priorities. Again, partly to take advantage of the fact that His Excellency is here this morning, when I said that increasing revenues is an imperative, especially for states. If you look at state and LGA revenues, they're very low. In fact, if you take out Lagos, its averages in 2022 was about 177 billion naira. Okay? The bulk of that came from transfers from the FAC, Federal Accounts Allocation, Federation Accounts Allocation Committee. The internally generated revenues were relatively tiny. So on this picture, this gray is the FAC allocation to the state. The dark blue is the FAC allocation to LGAs. And the light blue is the IGR of the state, and it tends to be very small. Now, why do I emphasize this? Because as we think about achieving the kind of vision that I think will be discussed you have to keep that in mind, in terms of these revenues. So just a very illustrative example. Okay, I think I actually did this kind of on the fly when I was visiting Plateau State, just saying, to get a primary healthcare facility up to a minimum standard, that's a one-time investment of, say, about 10 million naira. I mean, obviously it'll vary depending on the condition, but that's. Then I asked the person, the nurse who was in charge of that facility, and we just did a rough calculation, and I think our team has actually validated some of this. What's an estimated annual cost, operating cost of delivering a basic package of health services, 57 services, et cetera, everything from medicines, medical supplies, the personnel costs, transport, say it's 20 million per year. State with, say you want to do this for 500 primary healthcare facilities per state, that's roughly the number of wards, say one per ward. One-time investment of 5 billion, annual ongoing expenditure of 10 billion. So that's about 15, so let's say it's 10 billion with annual revenues of 177 billion. So that means at least 10% of the, or thereabouts of the budget should go towards health. But while, you make that case, even with the funds that are going to the health sector right now, those funds can be spent better. And this is just a simple example. There are other countries that spend as little as Nigeria does in terms of government spending on health. Yet, some of the core health outcomes are a lot better. Okay? So let's take Bangladesh, for instance. About $9 per capita. Maternal mortality is 123 deaths per 100,000 births. In Nigeria, that's over 1,000. Again, that number may be slightly out of date. Same thing on infant mortality. So you can do better even with the spending. So these are my last couple of slides. To spend better, that I think is the nut to crack. It's about more accountability. These are public sector reform type things. This is not medical science. It's about more accountability for how budgets are spent or why they're not spent. It's about better strengthened fiduciary systems, better monitoring, how staff are recruited. And actually, it doesn't matter whether you're talking about facility level health workers or whether you're talking about teachers. It's the same challenge. How they're recruited, how they're trained, how they perform. The second point is absolutely key. Clearer roles and responsibilities and better coordination between the federal and subnational, between the different ministries and agencies. And then on our side, greater alignment and less fragmentation, amongst the partners. We each like to plant our own programs and kind of reinvent the wheel. That's just, so many missed opportunities. So this is the thing, a renewed compact. It's not reinventing the wheel, it's just reinvigorating. And what it would mean, and this is what I've seen in other countries like India, Indonesia, Brazil, large countries with important subnationals, to really just revisit, what the roles and responsibilities are, and to formalize that in a compact or mutual accountability framework, which says, here's what federal can do for the states, and here's what the states will do in return, and vice versa. That, as again, many of you may know, is how a lot of the state programs that we support operate. SIFTAS, the State Fiscal Transparency, Sustainability, Accountability Program, that was that. It was just having a very clear conversation, jointly developing. It can't be one-sided. It has to be, everyone has to be carried along and agree. And from our side, certainly from the World Bank side, but I've heard that from all the other partners, we want to be part of this. We want to have that clear conversation, work with you. And I am done, just as I received time up. Thank you.
Please, let's give him another round of applause. Sometimes I wonder, colleagues who work with the World Bank, how they relate with their Nigerian folks in the village. Because I know that the representative of Sterling Bank, when he introduces himself as working with Sterling Bank, people go to him for loans and go to his office to cash money. But I don't know if anybody has ever successfully walked into the World Bank with a check in his hand and a counter, and they counted money for him. So how do you explain to your folks back home that you work in a bank, but the bank does not keep money in the bank? That is the beauty of the World Bank. But it's also the bank that ensures that the world development stays on. Distinguished ladies and gentlemen, it's my pleasure at this time to introduce my boss. And when I introduce this boss, It also makes me proud to say that I am an alumnus of some sort of the Harvard University, because he's a professor in the Harvard University and is one that is really seriously committed to development of health. His passion for reducing the mortality indices in Nigeria is palpable. His passion is so infectious that even the Permanent Secretary, Federal Ministry of Health, who is just 3 months old in the Federal Ministry of Health, now speaks like a doctor. Your Excellency, you only need to spend 10 minutes with this minister, and I'm very sure that when you leave here today, you're going to give more money to health for Ekiti State. And that is a trap that your commissioner actually set for you. All he wanted to do was to give you 5 minutes with the minister, and he's going to get all the money he wants. Smart young man. Dr. Filani. Distinguished ladies and gentlemen, it's my pleasure at this time to call to the podium the Honorable Minister for Health and Social Welfare, Professor Mohammed Ali Pate, to give his speech.
Well, thank you. Thank you very much, Chris. Your Excellency, the Executive Governor of Ekiti State, Abiodun Oyebanji, the Right Honorable Speaker of the Ekiti State House of Assembly, my very dear brother, the Honorable Minister of State for Health, Dr. Tunji Alaosa, other members of the Ekiti State House of Assembly and the State Executive Council, my Permanent Secretary, the Federal Ministry of Health, the Honorable Commissioner of Health and Chairman of the Commissioners Forum, Dr. Oyebanji Filani, and all other Honorable Commissioners of Health from the states that are here, the state primary healthcare development agencies, state health insurance authorities that are here, our distinguished development partners, and my dear friend Shubham, Dr. Shubham Chaudhry, Country Director of the World Bank, as well as the Director of the WHO here in Nigeria, and all other development partners, bilateral, multilateral, and our senior officials from the Federal Ministry of Health, including our chief executives of MPHCDA, NCDC, NACA, and other distinguished leaders that are here with us, and our traditional leaders. Ladies and gentlemen, good morning. The Honorable Minister of State has spoken, and I think he's spoken for all of us. So I could as well say that I stand by what he has said, because not much more to add for me. But it's indeed a great pleasure and honor for me to address this 64th session of the National Council on Health. This is the first since we both were appointed in the Federal Ministry of Health. And I would like to extend my deep thanks on behalf of all of us also to His Excellency, the Governor of Ekiti State, for hosting this year's edition of the Council meeting and making us all feel very much at home. I think the entire people of Ekiti State have made us very much feel at home since we've arrived several days ago, all of us in batches. So thank you, sir. It is imperative to state that the National Council, as prescribed by the National Health Act 2014, is the highest policy-making body in the Nigerian health sector and a platform where council members and stakeholders meet and interact to consider, deliberate, and chart ways forward on health issues of national importance. But as we do that, I would like to acknowledge that we stand on the shoulders of many giants who have walked through this path long before us. Right from the very beginning, ministers of health and commissioners of health. In fact, many years ago, it was the Federal Commissioner of Health, late Aminu Kano, what people don't realize, was actually a Federal Commissioner of Health. Professor Olikwe Ransom Kuti of blessed memory, as a Minister of Health, walked through the path that we are now building upon. Many others, Professor Shotimehin of blessed memory as well, some who are still with us, Professor Lambo, Dr. Adewale, and many others who have walked this path, both at the Federal Ministry but also as State Commissioners of Health. We are building on the path that they have bitten. And we're here as stewards of the health sector for the present population of Nigeria, but also for the future, until we hand over to the next set of leaders. The theme of this year's council meeting is building a resilient and inclusive healthcare system for a healthy Nigeria. And with the sub-themes that had been carefully chosen as laid out by Dr. Chris, who is a very able director of PRS in the Federal Ministry of Health. And we're here to highlight our priorities in the sector collectively, to take stock of our journey and putting into consideration the reality of our times, and to remind ourselves of the ultimate goal of achieving a system that ensures that all people have access to the needed health services, including prevention, promotion, treatment, rehabilitation, and palliation of sufficient quality to be effective, while ensuring that access to those services do not expose them to undue financial hardship. The health of the Nigerian people is not only a matter of well-being or economic productivity, but it's a fundamental human right. It's a measure of our commitment to equity, justice, and the dignity of every individual. Achieving universal health coverage is not a choice. It is an obligation. And it's an obligation that the President of the Federal Republic takes very seriously and has charged us to ensure we work together with all of the commissioners and the state governors to deliver on. It is a promise that we have made to ensure that quality healthcare is accessible to all Nigerians, regardless of their socio-economic status. It is the embodiment of our vision for a healthier and more prosperous nation, a strategic advantage for us as a nation, given the population that we have, as Dr. Shubham mentioned. And although great progress has been made over the years, in some areas that progress has been mixed, again, as our keynote speaker illustrated. The pace of our progress has not been commensurate with the investments, and the complexities of our health systems have only added to the drag on the movement towards the achievement of our collective goals. And I think our keynote speaker outlined that. That is the case for change. We also realize that a lot of the determinants of health are outside the direct control of the Ministry of Health, for instance, or the health sector. And that's why, in his wisdom, Mr. President, His Excellency Bola Ahmed Tinubu, in his wisdom, decided on the need to have the coordination function for health and social welfare, federal government, but also with the subnational governments, as well as with the international partners, so that we develop a structure and a framework to effectively and efficiently join our efforts to address all that is needed to improve the health of our population. It is on that basis that one of our first actions was to embark on a diagnosis system-wide, taking briefs from all levels. We have had 4 meetings with commissioners of health, I think, over the last 3 months, several with our development partners, visited states, visited facilities, spoke to our citizens, and we'll hear some of the voices of our citizens shortly in terms of what their expectations are. Consulting our state governors through the Nigerian Governors Forum and also individually, bilateral conversations with many commissioners of health, development partners, state health insurance authorities that have visited us in Abuja, members of the private sector, civil society, to understand the root causes, some of which were validated in our keynote speaker, that have led to the continued poor performance in the area of the health indices for us as a country, and to identify the low-hanging fruits that we can address in the short to medium term, as well as the broader health system strengthening efforts that in the longer term will accelerate our journey towards universal health coverage. That effort led to the 4-point blueprint that we developed, of which my brother has laid them out in his remarks, but I'll re-emphasize that effective governance is a key part of that. And that is the bedrock upon which UHC will be attained. Our governments must be transparent, accountable, and responsive to the health needs of citizens. We'll need to create and enforce policies that prioritize the health and well-being. Both public as well as private sectors have to be involved. And governance does not only stop at the realm of making the policies. We must establish the regulatory framework, the discipline, to ensure we work at the highest quality standards that is feasible in our healthcare system, and have safeguards to ensure that the resources that are being spent are better spent, as again our keynote speaker outlined. To have an accountable healthcare system that is responsive to the needs of the citizens, that is the only way that we can engage with them, regardless of their backgrounds, so that they get the care that they need, they deserve. And the National Council on Health is one of the most important governance and accountability platforms in the health sector for all of us. And we will maximize its potential to achieve our common goals. The second pillar is the efficient and equitable quality health systems. And again, this has been laid out, both in terms of the primary healthcare system, our hospitals as integrated within that, dealing with the human resources, the financing, and the communities around that effort, with quality woven through the whole effort. To unlock the healthcare value chain, which is an important element, the whole ecosystem that is bringing our private sector actors to unleash the potential that exists in our economy through multiple work streams. And His Excellency President announced the initiative to unlock the healthcare value chain as a presidential initiative, recognizing this imperative. And finally, the health security agenda, learning from the COVID-19 experience, as Minister Tunji also articulated, so that we are prepared not only for outbreaks, epidemics, pandemics that may come, but also displacements and challenges in the humanitarian setting, or with climate change and health, and the displacements that could occur with flooding and other crises. We will piggyback these efforts, starting from a point of view that we have a National Health Act that has created the Basic Healthcare Provision Fund, and to look at it carefully, and in this council we'll discuss it. How can it be more effective, more efficient, as a vehicle to drive some of the strategic shifts to improve the primary healthcare system on our path to achieving our wider goals? The President, in his wisdom again, approved for us at the federal government level the adoption, design, and implementation of a domesticated, context-adapted, sector-wide approach as an innovative, holistic, and coordinated strategy for improvement of health outcomes, which we will undertake with states so that collectively we move to improve the population health outcomes. As part of this National Council on Health, a detailed presentation will be made to you all on the blueprint and the approach that we're proposing. And we'll have an opportunity to hear your thoughts and further harness the support from you and the cooperation of our development partners, as well as civil society and the private sector, to drive that blueprint. It is pertinent to note that health is on the residual list of our Constitution, and the country is only as strong as its weakest link. To shift the needle, we require the full cooperation of state governments to ensure that health is put on the front burner of our priorities. And in doing this, the National Council on Health is the pioneer platform for effectively mobilizing the states to work with the federal government. The Federal Ministry of Health and Social Welfare is committed to ensure that we maintain the stability in the health sector that is necessary, and that collectively with you all, as a nation, we meet the needs of our growing population. This is in the spirit of collective leadership between the Federal Ministry of Health as well as the state ministries of health, between our president and the state governors, with the support of our private sector and civil society collaborators, as well as the international development partners. I would like to use this opportunity to reaffirm our commitment to ensuring that we accelerate progress towards UHC and implore all of you to come on board, because together we can achieve more. And as I conclude, I want to thank you, Your Excellency, once again, and your team, and especially your Honorable Commissioner of Health, for the fantastic work that you have started, that you are doing here in Ekiti State, and that you have laid a foundation for this 64th National Council on Health. I also like to thank the members of the Technical Secretariat, led by the Permanent Secretary, but all the Permanent Secretaries from the respective states who've done the hard work of building up the memos that we'll consider in this council. And that with this effort and what will come out of it as the Ekiti Declaration, I hope, if the council agrees, will ensure that the promise of progress and prosperity for all Nigerians in the health sector will be actualized, where no one is left behind. Nigeria's time is now, and God bless the Federal Republic of Nigeria. Thank you.
That has been the Honorable Minister for Health and Social Welfare, Professor Mohammed Ali Pate, CON. Ladies and gentlemen, a few weeks ago, the Honorable Minister for Health and Social Welfare called me to his office along with the Permanent Secretary and asked us what Nigerians feel about the Nigerian public health system. My Permanent Secretary looked at me and I looked down because I didn't know how to provide an answer. So he asked us to go to the streets and get the views of Nigerians and know whether Nigerians like the public health system as it is or not. And like the civil servant, obedient civil servant that I am, with the support of the Permanent Secretary, we went to the street. And we went from Borno to Sokoto, Sokoto to Lagos, Lagos to Benin, Benin to Calabar, Calabar to Jos. We covered 12 states, 2 states per geopolitical zone. It is my pleasure, the Honorable Minister hasn't seen this, and I deliberately, forgive me, Honorable Minister, I deliberately kept it away from him and from the Permanent Secretary. I hope I don't get a query. So that they too they will see it the way the rest of us see it and have their own opinion about what Nigerians feel about the public health system. So it's my pleasure to present the documentary, and I wish you a happy viewing. Thank you.
Providing equitable access to health care for every Nigerian is central in the country's National Health Act. But the Nigerian health system ranks poorly in terms of access and quality. Is this a hearsay or a statement of fact? Could Nigeria be described as a nation with a public system that works for all? The only way to ascertain these is to feel the pulse of citizens on their experiences in the course of seeking services. Let's take you around the 6 geopolitical zones for people's experiences with government-owned hospitals. Welcome to the Northeast, where Borno State, Bauchi and 4 other states fall under.
A da yanzu haka suna taimako sosai ba laifi, suna taimaka mana sosai ba laifi, gashi taimako ko ta ina suna ta mana aiki ba matsala. Sikila ne ke damun shi ne. Tun da na haife shi har ran ta wata 6 ina zirga-zirga asibiti da shi.
I just had a brief experience, and the only experience I can talk about is the fact that I went for a test, which I found out that there were certain people that were already on the queue for almost 3 days. But because I had somebody that knew somebody, we like shunted the line, and I just simply did mine, had mine. But it felt bad knowing that some people have been there for more than 3 days on the queue. So I think maybe by the time we got there, I realized that we had little or less number for the machines that are available to do this.
My brother, I am a witness. She lost a baby the first and the second time at teaching hospital due to negligence of the doctors. I discovered that one of the doctors, when he was administering her, she is a Ghani issue, along the line, he was browsing, he was asking, making calls, asking what next to do, what to do. You know, it's surprising. I expected as a professional, you know what to do at a certain time, but you cannot be making call, browsing, checking what to do.
There are some drugs that we already know the government is saying free, but when they want to prescribe it, no, they hike the prices, even more than the ones you can buy in the chemist outside. So I think a government at the top level should be more concerned on monitoring the activities and services of all the hospitals, whether primary health or bigger hospitals.
Some of them, I don't know, because there was a time I was even asking one of the Oga there, I was asking them, do you normally give your staff formal training at house as in how to relate with their client? Because the way they react, the way they talk to you, the way when you talk to them, the way they respond to you, sometimes they respond in a very harsh way.
The challenges we have is about the staff. We are in scarce of the professional staffs. We don't have them enough. And some of the equipment for improving our services, like 2BP apparatus, the still thermometer, stethoscope, and some delivery beds, and so others.
As you can see, we have many clients, and we are not many. But now, alhamdulillah, we have enough staff and everything. There is not any problem.
What obtains in the northwest, where the searchlight was beamed on Kano and Sokoto?
I have been to the hospital, and there are a lot of changes compared to previous, because the doctors doesn't used to attend to people like that, but now they are trying, especially the nurses. They are trying. I can give them credit now, what I have seen. Because before, you normally go, doctors were not there to be found. But most of recent, I took my mom and I was given a good treatment, yeah, to be honest.
My first time visiting Kano Teaching Hospital, the experience I had there was very terrible. I went there as early as 7 a.m., but I was not able to see the doctor even getting a card. I queued from morning till night, to the extent that this ailment that even took me there, I developed something that is what, as in I left there very weak and very down. I did not get the card, come to talk of even seeing the doctor.
When my wife had an CS at the Nassau Hospital, that very day, it was very difficult for me. Because when we got there was no single doctor. So during that period, I have to go and buy fuel in their own motor to go and pick the doctors in their houses that very night. Before I can able to get the whole doctor, I bought fuel by myself in the government hospital. Then I went to pick the doctors in their house. Before they came, they do the CS. But during that period, I did not pay anything. They always say I should go and buy the CS medicine, other things, like the injection, every other thing I bought then, just beside the hospital there, and they do it successfully.
The hospital I visited last is only if you don't have somebody. If you reach that place, at least you will suffer, but if you know person, everything will be easy for you. It's not how it's supposed to be. Whenever you go to the hospital, as far as it's government hospital, you're supposed to be treated equally. But sometimes they look at who you are, or who came from, or who directed you, or who carried you come hospital. Why it's not supposed to be like that?
There was a time when my sister was admitted. She was about to give birth, but it's like the doctors there, they don't take care of the patient, and at the end she lost the baby.
The one I visited was Murtala Mohammed Hospital, but it was successful. I'm happy the way the doctor approached me and treated me.
gaskiya abubuwan da aka yi mana na asibiti din gaskiya suna ba mu haɗin kai kwarai da gaske. Da yanzu kaga ban wuce minti 20 da zowa ba, amma kaga har an riga an ƙarishe min duk abin da duk bayanin da na zo da shi an riga an karɓa kuma an rubuta. Da wani tas wanda zan yi na riga na yi shi sun bani goyon baya kwarai da gaske.
Gaskiya alhamdulillah mu dai asibitin gidan yan mu dai nan ne gaskiya ba mu da tankarta. Gwargwado suna kula da wayanda ka kawo yara kuma yan an kai mana allurai ana ba ɗiyan gaskiya ba mu da korafi tsakani da su dan suna yi gwargwado kuma suna haba-haba da mutane. Gaskiya duk gidan yan ba mu da kamar waga asibiti.
Well, as you can see, the general condition of the hospital is bad. Be it road network, the condition of the wards, electricity supply is on and off sometimes. The generator is helping us, but the diesel is very expensive. If we can go to solar, I think that would be a better option than purchasing diesel. The wards need to be renovated, upgraded, and so to have enough infrastructure, beds, mattresses, drip stands, windows to be fixed, doors, mosquito nets, fans, lighting, then equipments.
From the northwest, we take you to the southwest, particularly Lagos and Oyo states.
The attention of the health workers there. What I can realize is that they have been overworked due to not enough staff. Well, I'm satisfied. They are doing all they can do within the scope of the what they provided for them in terms of equipment and human capacity.
If there is enough equipment in government hospitals, if there is enough personnel in government hospitals, the people like me won't patronize private hospitals. Definitely, in as much as what we can get, and the private hospitals that we are patronizing are readily available in government hospitals, we definitely shift over to government hospitals. And that is why I think the government should do more in equipping the government hospitals, both in terms of the personnel as well as their equipment.
Personnel welfare is poor and it's affecting the output. Where 100 people are expected to work and we have only 25 that are working there, the output is not going to be good. But we cannot kill the 25 that are working, that are doing the task of 100 personnel.
What I like about them is that they are giving best treatment to people. But what I don't like is that there is a lot of stress. Patients, relatives are passing through a lot of stress in government hospitals nowadays, like going for one code or the other before having access to any aids, before they can attend to you very well in the hospital. That's the only problem we are facing.
Next, on the experience sharing train is the South-South experience with focus on Edo and Akwa Ibom states.
Recently, is it not January, when I went to General Hospital in Ogun, the doctor there is even telling me that I should come to his hospital. There's no doctor here. I told the doctor, don't worry. Instead of me to go to your hospital, I rather prefer coming to Otiwo.
My experience of my wife when he come, as my wife get belle when we come here, as he get belle when we come here, as they read that they say the belle don't die for stomach. So next time, say they eject am, so he born the baby. They go through it, you know, use operation born, but later I can't discover say they don't do operation. And another operation when they do, I know they are aware, I don't know how that operation take place. We then after the operation, we stay about 7 months for 1 year. So as we spend 7 months. Last I can't discover say body come dey swell up. I manage now. I don't know how much I had to bring and come for hospital again. And then one doctor call tell me say because they talk and say this person don't get belle. Now the second doctor say this person when they remove the wood, he don't get belle. Now for that I even know say they remove my wife, they turn the wood. So later now, the wood they turn the wood. Later now, and the woman now, the sickness come turn to kidney. From there, I can say now you cannot survive that side.
Today now, as a company, there is doctors, but no mercy. It's equivalent to see there is no doctor. Because doctor prescribe and there is no mercy. You go to pharmacy, nothing. I'm just coming from there now. Here's my card. Any hospital without mercy is no hospital. So if a federal government can come up and raise this hospital to the normal standard, it will be good.
The proximity to the lab is far. I guess they should do something to bring the lab together, because picking one thing from there and going there to pick another one and there to pick another one, I think it's stressful for the patients. So I think the lab, something should be done to bring it closer.
Your Excellency, Honorable Minister, looks like somebody here has seized the voices of Nigeria.
This morning, I came to find out how much is dialysis and blood and all those things for somebody, my mother, to be, dialyzed. So it's good to come to government hospital. No matter the stress you go through, is the best.
The experience I had last time I went to my village, somebody was sick. Before we could rush the person to the hospital at Ukubidi, where we have as an headquarter of Okobo, the person had already given up. Why? Because there was an emergency unit which would have been taken care of as a first aid before the person could be rushed to the hospital. So thereby giving a much challenge faced by those in the rural community, like in my own particular place, like I've mentioned at Tabon, in Okobo.
Will it be a case of different strokes for different folks, as narratives from the Southeast Zone beckon?
Me personally, I don't access public health care. If I have an issue, I have a personal doctor. Because from my experience, most times when you go to public hospital or government-owned hospitals in Nigeria, the first thing they tell you is money. As in, you have to deposit this first. They don't think of saving lives first. Even the government people themselves, government top shots, if the hospital in the Nigerian hospital system was that good, why don't we used to meet them in hospitals? They don't go to government hospitals. It's either they are flying out or they are inviting the doctors to come and meet them at home.
They have been trying, but recently there are recent changes. For instance, the registration fee has gone up to 15,000, from 11,900 to 15,000 naira. Then delivery, for self-delivery, is almost 50,000 naira, and every other thing. Consultation fees used to be 500 naira. Today we paid 1,100 naira. So that's my observations. I thought since it's a government hospital, we are not supposed to pay as much as that. But the doctors, the nurses, they are really doing good.
I came here around before 1 hour. The doctor that are working here just do the operation fast. About 2 people. They are trying.
Abuja, the nation's capital, is home to many public health facilities that cut across primary, secondary and tertiary health care, including the National Hospital, adjudged to be one of the centers of excellence in the West African sub-region.
The only thing, the service here, since from the very first day we came here, the way they attended to us, and the medication and everything, and anytime if my baby are feeling, we are noticing anything, whenever we rush, the way they take good care of the babies. So that's why I always have full confidence using this place.
I like their swiftness in they are always ready to assist and to help patients, but sometimes when you go to the hospitals, you hardly find some doctors, so you have to wait for a very long time.
I visited hospital, but to my own, the last time I mistakenly visited my Chama General Hospital, I think I fell down nearby there and I rushed to hospital there. I have to be sincere with you. I saw below expectation.
When I visited my NHS hospital, that is Gabi, they treated me well. As I went there, that there's drugs. Even drugs is not even cost. They say they know my NHIS is not carried. Then I wanted to go and pay it. They write it 250 naira. Then the man that they say is the manager say that it's not like that. It's 2,000 plus. So I say I won't pay for it. Later I said, let me go and pay. Then I pay it and collect it.
As the North Central holds sway, not too far away from Abuja is the neighboring state of Kogi. What is the conversation?
On my own experience, I would still say on my dad, I took him to the hospital. That was some years back. He had a dislocation on his leg. He got a tore rather on his tendon. We took him to the hospital. Before my dad was treated, it took hours. We went there from morning. Before they attended to him was in the evening. We even had to make a call to the director in Abuja for them to attend to him. And I mean, the pain, someone in his 70s going through such pains was not administered to immediately. It's quite painful.
It's too much bureaucracy. When they know that you have a patient at the emergency, they will not give you the drugs. They ask you to go. No, you have to go and pay and come back, which will take time also affect your patient, which is part of what I experienced in Federal Medical Center. That led to the death of my 20-year-old son.
As I was a day, I went to the hospital. I met a crowd. Who were just shouting the patient. They abandoned the patient, and the people, what is it called? Parents came. They said, I'm going to soon. Some of the doctors were just begging. I know it's because of lack of doctors. Assuming they have enough doctors, they won't have abandon any patient because you're there. Pay for the service they're going to render. So there's no need for them to abandon the patient. No.
It is said that quality health is not a right that can be enforced in a court of law, but every government has an obligation to provide quality healthcare services to its citizens. Amid President Bola Ahmed Tinubu's renewed hope agenda, the coordinating Minister of Health and Social Welfare, Professor Ali Pati, and the Minister of State, Dr. Tunji Alausa, unveiled a 4-point agenda that would ensure that the sector delivers improved healthcare to Nigerians. How far this will go in bringing about a public health system that works for all, only time will tell.
Distinguished ladies and gentlemen, those are the voices of Nigerians, the opinions of Nigerians about the public health system, both at the federal, state, and local government level. We have gone around the country, and now everybody here is a major stakeholder in health. Time, they say, will tell. I thank you all very much for your attention.
Thank you very much. Very quickly, please permit me to appreciate the Permanent Secretary in the Health Sector in Ekiti State for doing a great job to ensure that we have a success of this council. From the Permanent Secretary, Minister of Health, Mrs. Olushola Gbenga-Igotun, you are appreciated. The Permanent Secretary of Hospital Management Board, HMB, Dr. Lasun Komi Alabi, thank you very much. And then the Primary Healthcare Development, Executive Secretary, Dr. Shelwa, thank you very much for all you have done. And of course, the other top government functionaries and their workers. Your Excellency, distinguished ladies and gentlemen, now it is time for me to invite this great man, calling me rallying point. Of course, you are right, because you discovered that it's about the only governor that have a very cordial relationship with every governor that has ever ruled the state. and of course taking advice from them and having a very good working relationship. He's a man that has touched virtually every sector since he came on board, such that people today, even while just 1 year in office, they are rallying for him to go for a second time. I tell you, in health sector alone, you can count up to more than 50 points of achievement. You're talking about renovation of medical facilities, talking about construction of health workers' quarters, talking about procurement of medical and health equipment to training and capacity building for health workers. You're talking about disbursement of funds and interventions, and then installation of oxygen plants here in the state, and then free health to some certain people in the state. I have the honor to bring up this wonderful man, this great man, a round peg in a round hole in Ekiti State, His Excellency, Mr. Biodun Abayomi Oyebanji, the governor of Ekiti State, as he delivers his address and declare this council open. Mr. Governor.
Please sit. Thank you. Good afternoon, all. Well, let me front-load my appreciation to the Coordinating Minister of Health and Social Welfare for helping me to establish protocols. I've been struggling with how we do that without leaving anyone behind. So I will adopt the protocol as established. Because in a conclave of juggernauts in the health sector like this, and you are not a health practitioner, it may be difficult for you to establish the protocol properly. And I've learned this when I went to a function in NBA. I was taught that there's a distinction between member of the bar and member of the inner bar. You know, and there's live benchers, there are also all sorts of nomenclatures. So thank you, Honorable Coordinating Minister, for helping me to establish protocol. But I must, in the spirit of Ekiti people, to extend courtesies to some people having established the protocol. I will start with the Coordinating Minister of Health and Social Welfare. Thank you so much, sir. The Minister of State, the Permanent Secretary, I joined them in affixing MNI to your name, so I don't run into trouble too with you. And the Right Honorable Speaker of the Ekiti State of Assembly and distinguished honorable members that are here. I will use the Secretary of the State Government to extend courtesies to my colleagues in Council. The Honorable Commissioner of Health and Human Services, Ekiti State, the man in whom I'm well pleased. I thank you so much. I will use you to connect with your colleagues, Honorable Commissioners from other states of the nation that have converged on Ekiti State. I will use Shuban to connect with all the country directors and representatives for development partners that are here. Our own the DGs, NCDC, thank you so much, ES, and stakeholders in the health sector. You are welcome to Ekiti State. It is with great pleasure that I welcome you all to Ekiti State for the 64th National Council on Health. It is an honor for us to host this esteemed gathering of health policymakers, professionals, experts who play a crucial role in shaping the health landscape of our great nation. As we know, the National Health Act recognizes the NCH as the highest policy-making body within the Nigerian health sector, saddling you all with the responsibility of formulating policies that protect, promote, improve, and maintain the health of Nigerians. Members of this country truly carry upon their shoulder the weighty responsibility of driving Nigeria's health system, as your decision will have a significant impact on health outcomes in the near future. Therefore, the task that is laid before you today is of a very great importance. The Council is particularly special as it is the first in the new administration of our beloved President, Asiwaju Bola Ahmed Tinubu, and pivotal to the actualization of the renewed agenda in the health sector. As we convene under the theme Building Resilient and Inclusive Healthcare System for a Healthy Nigeria, and explore the sub-themes of harnessing evidence-based research and development for better health strengthening healthcare access and institutional governance for universal health coverage, innovative financing for the 21st century, healthcare agenda, and digital transformation and health information systems, we acknowledge the critical importance of these pillars in shaping the future of healthcare in our great nation. The overarching themes underscores our collective commitment to delivering a healthcare system that is robust, resilient, and inclusive, ensuring that every Nigerian has equitable access to quality healthcare without financial hardship. Gleaning from the sub-themes, we recognize that evidence-based research and development are the foundation of progress in every sector, including healthcare. Through research, we can generate data to guide decision-making and enhance our understanding of health challenges. Research is also critical for the development of effective interventions, and Ekiti State is eager to contribute to these collective efforts by creating an environment conducive for research and development. Hence, our continued investment in higher education and the establishment of a knowledge zone in the states. In the health sector, we have demonstrated significant commitment to improving the health status of our populace through a holistic approach to health systems development, with particular emphasis on strengthening of our primary healthcare system to promote a preventive approach to health and as the entry point to care as we strive to achieve universal health coverage. Our investment in the necessary inputs to improve service delivery range from infrastructural upgrade, improved welfare package for our health workers, and a focus on the availability of good quality drugs. Mindful that service availability and readiness alone do not guarantee utilization, we expanded our flagship health insurance program, Ulerawa, to all the 177 PSCs in each of our political wards in the state. Today in Ekiti, everyone can access a comprehensive package of primary care interventions, such as family planning, antenatal care, delivery, postnatal care, under 5 illness and malaria treatment for all. Access to healthcare, as we all know, is a fundamental right, and institutional governance is the key to ensuring that this right is upheld. By strengthening healthcare infrastructure, optimizing service delivery, and promoting good governance, we pave the way for the realization of universal health coverage, leaving no one behind. Finally, embracing digital transformation is imperative in the 21st century, and nowhere is this more critical than in the health sector. Ekiti State is committed to harnessing the power of technology to enhance health information systems, streamline processes, and improve healthcare delivery. Hence, our eagerness to collaborate on initiatives that leverage digital solutions for the betterment of our health sector. As we embark on today's deliberation, I appeal to everyone to bear in mind the people who we serve, the Nigerians nationwide whose lives will be impacted by the resolution we make today. Just watching the video, one point struck me, a man who said that he went to a public facility by mistake. And it really struck a very hard chord in me, because that should be the first point of call. But he felt that he made a mistake going there. As we put forward and step down motions, let us bear our dear country in mind and ensure that we come to conclusions that serves our collective peace and prosperity. Let our discussions culminate in actionable strategies that will contribute to the realization of our vision, a resilient, inclusive, and healthy Nigeria. And while you are at it, I hope you enjoy the warmth hospitality, and rich cultural heritage of Ekiti people. Among other things, we are globally famed for the quality of a pounded yam and a foriro, and I will advise all of you that you must taste this before you leave. If you have not been to Ekiti State. And our people are ready to make that available. I'm not sure if Shuban has had a taste of that. I hereby encourage you to indulge and truly confirm that you have come to Ekiti by tasting a pounded yam. On the final note, I extend my sincere appreciation to the honorable coordinating minister and all his team, the National Council on Health Secretariat, and all participants, especially the Ekiti State Commissioner for Health. I must do this publicly. Doc, thank you so much. I'm extremely grateful for what you are doing, and I thank you for offering your services to your people. I know that it took you a lot of time to stay behind, but you can now see that the best service is public service. Thank you so much. I'm really grateful for what you are doing, Ekiti. And I also thank your team for working around the clock to make this available. I'm extremely grateful on behalf of the team. God bless you. I pray that our collective effort through this council lead to transformative outcomes for the health and well-being of Nigeria. On this note, it is my pride and singular honor to declare this council meeting open to the glory of God and to the benefit of Nigerians. Thank you, and God bless you.
Another round of applause for His Excellency. I want to particularly note the comment of His Excellency that we should taste the pounded yam. And I'm re-emphasizing this. PAMSEC, HMB, and PAMSEC Health Ekiti, we've been talking about pounded yam. You've heard His Excellency give that instruction now. So I will have 3 doses of pounded yam per day, morning, afternoon, evening, until I leave. Your Excellency, honorable ministers, my permanent secretary, honorable commissioners for health, distinguished delegates, our guests, ladies and gentlemen, it is my very singular honor and pleasure to invite the Amiable Permanent Secretary, Federal Ministry of Health and Social Welfare, Ms. Kachalom S. Daju, MNI, to give the vote of thanks. While she comes on, I would like to remind us that His Excellency, there will be a photo session. The Excellency will have a photo session with a few people before we will proceed to the exhibition stand to view what we have displayed on the exhibition. Madam Permanent Secretary. Thank you.
Thank you, Dr. Chris. Your Excellency, the Executive Governor of Ekiti State, Abiodun Oyebanji, the Honorable Coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Pate, and the Honorable Minister of State for Health. Please permit me to adopt the already established protocol. The protocol is quite long, so I will stand on what has been established. It is my great pleasure to give the vote of thanks at the executive session of the 64th National Council on Health, holding in Ado Ekiti, the beautiful capital of Ekiti State. Distinguished ladies and gentlemen, you will agree with me that the past 3 days, the technical session has indeed been an interesting experience, where discussions on health sector strategic blueprint and outstanding memos were deliberated upon. The outcome of the technical session sets the agenda for today's discussion. Permit me, Honorable Minister, sir, Your Excellency the Governor, to appreciate all delegates and participants during the technical session. By these, I mean the state permanent secretaries who were here, the state health insurance and primary healthcare development agencies, and the state directors of planning, research, and statistics, as well as our wonderful development partners who have been with us since Monday. Your contributions were insightful and noteworthy. Particular gratitude goes to the Coordinating Minister of Health and Social Welfare and the Minister of State for their unwavering commitment towards ensuring a healthy and prosperous Nigeria in line with the renewed hope of Mr. President. May I, at this juncture, wholeheartedly appreciate the government of Ekiti State under the leadership of His Excellency Abiodun Oyebanji, the Executive Governor, for graciously agreeing to host this important event. We fully recognize the sacrifice made, bearing in mind the multitude of pressing needs that compete for the scarce resources of the state. The decision to host this to host this meeting exemplifies the state's unwavering commitment to prioritizing health. My special appreciation also goes to the Honorable Commissioner and his team. The team was quite indefatigable. And Your Excellency, sir, I want to say on behalf of the Federal Ministry of Health that your team, the Commissioner of Health, his PAMSECs, and the entire team have done a wonderful job, and we want to thank you. To all the Honorable Commissioners of Health here present and other delegates, your efforts towards achieving universal health coverage in your various states is well appreciated. But above all, I would like to thank the Director of Health Planning, Research and Statistics and his team of the Federal Ministry of Health, who together with Ekiti State have put up this wonderful event of the 64th National Council on Health. There's something my minister said once he became minister. He said the health sector has to be re-engineered, reinvigorated. And he has this saying that keeps resonating in everything we do. He says, for the health sector, our goal is to save lives, reduce physical and financial pain, and produce health for all Nigerians. That is why we are here today. And together, I want to believe that we can make a significant impact on the future of healthcare in Nigeria. At this juncture, Honorable Minister, Your Excellency, the Executive Governor, Honorable Commissioners, distinguished ladies and gentlemen, and I have not forgotten the Fourth Estate of the realm, the distinguished members of press. Thank you very much for your kind attention, and may God bless the Federal Republic of Nigeria.
Please, let's give her another round of applause. Thank you very much, Madam Permanent Secretary. At this juncture, we'll take the national anthem, and then we'll proceed for the photographs. National anthem, please.
Àti gbòmìnira ọ̀rọ̀ kan làwa ń ṣe. Ekiti, Ekiti ti gbòmìnira. Ekiti, Ekiti ti gbòmìnira. Àwa Ekiti iwájú la ó máa lọ lágbára
Let's have the group photographs. On the stage, Your Excellencies.
Dear listener, this is the end of the road on the live transmission of the National Council on Health meeting that came up today in Ado, Ekiti, where we have distinguished ministers and, of course, state ministers. We also have commissioners all over the 30 states of the Federation who actually came to grace this particular event. And we have come to the end of the show. I want to say a very big thank you to the management of the Broadcasting Service of Ekiti State. Likewise, I want to say thank you to the Director of Engineering Services, Ibukun Olasami, and all other members of the outside broadcast team who came here to actually carry out this assignment. My name is Oluwasegun Fomi Ogbimi. I'll be handing over to the microphone to my colleagues who will be telling you what actually happened today, and they will also sign off in Yoruba and Pidgin English, respectively. Bye for now, and God bless you. Over now to Remi Okunla.
Some can stay at the back. There is space at the back.
Iléeṣẹ́ rédíò àti tẹlifíṣàn ìpínlẹ̀ Èkìtì tí a takọ̀mọ́lẹ̀ sí ìlú ní ìlú Adó Èkìtì láti sọ fún yín látàárọ̀ pé ibi tí a wà náà ní AB Civic Center lópòpópó Ọládébáyọ̀ Ládó Èkìtì níbi tí a ti ń mú ètò ìlera lágbàáyé léyìí tí wọ́n gbé wá sí ìpínlẹ̀ Èkìtì tó jẹ́ pé ìpínlẹ̀ Èkìtì gangan ló jẹ́ agbátẹrù ẹ̀ níbi tí gómìnà ìpínlẹ̀ Èkìtì ọ̀gbẹ́ni Abíọ́dún Àbáyọ̀mí Oyèbánjí ti wà níkàlẹ̀ pẹ̀lú àwọn kọmíṣánná àti àwọn mínísítà fún ètò ẹ̀ka ti ìlera lórílẹ̀‐èdè Nàìjíríà pátápátá tó ti wà ní ìjókòó. A lérò pé gbádùn gbogbo báyé fi wá sójú àwòrán yín. Ọpẹ́ lọ́wọ́ àwọn lọ́gàlọ́gà ilé iṣẹ́ yìí fún ìṣẹ̀lẹ̀ pàtàkì yìí. Àwa ń fi àsìkò yìí kí yín pẹ́ kú kalẹ̀. À ń dágbére báyìí. Rẹ̀mí Òkunọlá lórúkọ mi, ẹnìkejì mi wà níbí tí ó bá yín sọ̀rọ̀.
Yes, so my people, now they are here we come there for the 64th National Council on Health for Ekiti State, where na Ekiti State himself na host am. Yes, as the program take dey go, una know different people, big men from different states don come assemble for Ekiti State on top the National Council on Health matter wey dem dey discuss for here for Ekiti State. As we take know on top how we health go take better, na we dey. The program still dey go on, but from Ekiti FM 91.5 and Ekiti Television, we go dey press break small. We go enter the our bus stop small. As the program still dey go, na for am to better. Abi una person Christy Ishola Yusuf, make una stay tuned. Bye for now.